Hello, everybody. This is Dr. Lyons from Budapest, Hungary. And as I promised to you, I get a very, very special friend and doctor in front of us today to talk about his passion with ELO Kaqun water. ELO is a brand of Kaqun in Malaysia and in Singapore. And we will have a very nice chat about the last 6 months, how we dealing with all this COVID situation. And also we will talk about how the immune system should be prepared if anything could happen, like bacterial infection, fungal infection, or viral infection. We will talk about this, and I want to keep not too long to keep you waiting, because I know from last week, everybody asking me in 5 countries, from Canada, welcome everybody. I see people from Canada, from Germany, from Austria, from Malaysia, people signing in from Singapore now. Welcome to them too. And I would like to, start up on this and introduce you, Dr. Syed, who is my very Hello, how are you?
Hi, Robert. How are you? Wow, it's a pleasure meeting you
Fantastic.
in Zoom. You see, this technology is very good. We are far, but we are near.
Yes, I've been in your country several times. You've been in
Yes,
Hungary
yes,
doing very
yes.
special presentations, and
Right.
I see you very healthy, looking strong, and
Yes, thank
we
you.
are we are doing here the same. So please introduce yourself to the viewers, because you are the best on this. Who you are and how we met, how we get together, who you are.
Okay, all right. Hi. My name is, I have a long name, but my full name is Syed Abdul Aziz Syed Zain. So it's long. So, but you can call me by my first name. I'm known as Dr. Syed, okay, to you and to my friend in Malaysia. I'm a cardiac anesthetist by profession. I still practice at the one of the big national heart institute Kuala Lumpur, and I do give anesthesia for heart surgery. So this is what I've been doing for the past 20 years of my life. Okay, I used to work in Doha, Qatar for Middle East, 2 years in Kuwait, and then another 8 years in Qatar. So altogether, I was away for about 10 years, and I came back in 2017 to offer my service now to my fellow Malaysian, and now I'm hooked up with with this Elo water, or Kaqun water, is in Europe, and I think it's a really blessing in disguise, because I didn't expect to finally talk about water, which is a bit strange for me, because as a doctor, we used to talk about cardiac anesthesia, how you give anesthesia, and suddenly now to talk about oxygen-rich water, which is ELO, which is a very interesting indeed. Okay, so thank you very much, Robert. Because you are the one who make it happen, and thank you again to to our Islam, the Singapore counterpart who believing in you, and then make it available now in Malaysia for us to use it and reap the benefits. So I really thank you, for including me into your family.
Thank you so
Right,
much. I
right.
remember the first time we met, you as a
Mhm.
medical doctor, you were not very convinced about Kaqun water or Elo water, we call it. You were not
Yeah.
very convinced. Can you tell me what was in your mind? Can you tell?
Well, I'm sure in the world there's so many water available, right? So I'm there's hydrogen water, there's an oxygenated water, there is alkaline water. There's so many water in the world, and Malaysia is also not spared. You see, because when you as a medical person, the people are approaching me because they know that I'm a doctor, and then they want me to promote, why don't you use this alkaline water, why don't you use this hydrogen water. somehow the concept, the scientific reason behind it doesn't blend into your head. You see, even when I was listening to this water, it was first introduced to me by somebody in Qatar many at about 3 years ago, about 4 years ago. He was introduced to me. I mean, the concept doesn't blend into your head, because I thought, how can oxygen, be used in the water and can be used to, you can drink it, absorb it, and then can be used by the tissue oxygen. It doesn't make sense at that time, you see. So of course, naturally, when you listen to all these things, you just put it behind, because you don't feel the need, because you are healthy, I don't feel the need for me to do all that, for me to drink all these thing. Like I said, I don't believe it until about 8 months, about a year. I think about a year after that, I was having some issue with my own health. So of course, when you are being a conventional doctor, cardiac anesthetist for that matter, so I began to find out whether the symptom, whether the things that I'm suffering at that time, can I use other alternative medicine rather than the conventional medicine. So that's why it ring the bell again, about the concept of the water. That actually I flew down to Singapore, and I remembered one fine Saturday I took a flight from Kuala Lumpur to actually met with Dr. Choi, Dr. May, our dear friend Dr. May, and she explained me in a more scientific way, in a more bigger picture, for me to understand it more, that this water is actually different. I began to know about I began to know about some scientific study that was done in Monash University to actually investigate about the water scientifically, then make it more sense. So I say, okay, I mean, like, there's no harm for me to try. Actually, I tried it for about 4 months until I was okay back. So that was the starting point. Even though I don't actually believe it 100% at that time, but when I began to use it, I began to experience it. I began to share it with my own family, relative. I can see all the good points. All are bounded to the fact that many common diseases that we know are actually associated with the low tissue oxygenation, which it can happen to anybody, right? So that idea is so simple, but yet so significant, and I seen it, on the prolonged usage, on consistent usage of this water. Some of the common diseases which is related to hypoxia actually can be reversed. So that was the starting point, and I began. And of course, I know I've been telling this story about my cousin who actually was diagnosed to have cancer, and then I didn't expect him to live, but he lived until now. He was 72 years old at the time, Robert, when he was first inflicted. So I thought that was the end of him. So somehow God is great, he believed in me, so he used it, and for him, miracle does happen. Actually, I mean, it happened just by reversing back the tissue oxygenation. He sort of reversed back the
So
cancer that he had.
how could you explain in your hospital? How could you explain to
Mm.
your colleagues when they see such
Yeah,
like that for the last stage cancer patient, just
right.
by God grace, just come back and live another
Yeah,
4 or 5 years?
yes. Well, I mean, of course, I was fascinated by the study that was done by your good self as well, and also by ILO, where they use ILO to in the scientific study. They would, when they um,
That,
injected with these mice, right? The
uh-huh.
mice study, right? The mice
Yes,
study where
yes.
then they inject, and then they put these two group of mice. One drinking ill water, the other one is drinking tap water, and how the tumor become enlarged for this subset of mice that drink tap water only. And you see, and then the other one that then the other thing is that when you for the mice that drink ill water, then they found that the value of oxygen inside the cancer become higher. So we know that this is already a well-known fact that hypoxia is the main cause of cancer, right? So if you actually measure any tissue cancer for that matter, you will find that all this cancer tissue would actually become reduced in oxygen, and that's flourish it, make it more malignant, make it more, make it the cancer more propagating. You know what I mean? So to become cancerous to you. So when this study was mentioned to me, so I was fascinated. You see, I was really discussed in detail at that time with Dr. Chua that how could that be, and then she explained the pathology and then the pathophysiology behind it. So then when I see it happening to your own family without any other intervention, this could be the only reason, you see, at that time. So now, because now that I know you more, of course, when you discuss about this disease, is you have to be very careful, because we don't want to mislead. We do not want to mislead the community, but yet, but this is something that you can consider, because by reversing the tissue oxygenation, you can actually reverse back whatever the bad thing going on in your body, including cancer. So that's the thing. That is how I explain to my community actually, and
Okay.
they believe.
Thank you. So what happened is, I can tell you now, more and more publications coming out almost every day, something new publication coming out of hypoxia-related diseases, not just cancer, not just diabetes.
Yes, of course.
Just a simple inflammation. But before that, I remember just 5 years ago, when we talk about HIF-1 alpha, not very many people knew about it, only the ones who read the study. But now, after 5 years, it became so important issue. Let's say 5 years ago, I made the blood work, designed the blood work, where physicians can look at natural killer cell functions, killer cells numbers, cytotoxic index, vitamin C in the plasma, vitamin C in the tissue, and underlying, we had HIF-1 alpha. So we recognized very quick, if the killer cells are capable to find and see, recognize tumoral cells, and they cannot go in to destroy that, it's because of the hypoxic wall. And if we can somehow eliminate that hypoxic wall, everything goes back normal. Now, I'm not saying this to you, I created this, I'm saying this to you. I read the literature 2017, August 15, that was coming from 2 Belgian professors. The study was published in Nature in United States. It was a big controversial study, because it showed every single cancer. They checked 3,000, not 30, not 300, 3,000 different type of cancer was lifted from the patient, and they find out if the tumor is hypoxic or not. And guess what? Every tumor was hypoxic. Some of them very high, some of them low. So we are getting close to this. They prove that no matter what you do, when it starts, it's coming with the first cell death. And this is coming because of the mitochondrial dysfunction. And that's what is happening. So I'm very happy when you're talking about how you find out about it, and is it helping you? The water did help you. And that was the turning point for you. Then as a good prophet in Malaysia, you are a good prophet in Malaysia, talking to the people about what you see in Europe. You come here, you met our Hungarian patients who run through the And I think that was convincing for you too.
Yes, of course. So because now I think in Malaysia is about I think it's about nearly 3 years, you know. Then I have many patient, diabetic patient, and I have a few, you know, testimonial, very good testimonial. I think I mentioned it to you about this lady. Who was diagnosed to have a dilated cardiomyopathy. You know, this is during the earlier part of my encounter with this with you. She somebody referred her to me because at that time she was suffered from dilated cardiomyopathy, non-ischemic in nature, where the left ventricle function is about 14% only. She was very cachexic, you know, she was very thin. She every few steps she was breathless, and then she was asking me, she was looking for miracle, you know, because she is already in the hospital for so long, and then she on all sort of medication, nothing happened. They said, I mean, like she heard about this water, whether I can help her, and I said, we can try, but you know, you can try, but you have to drink consistently. You have to drink within the allowable limit, because she, remember, she had dilated cardiomyopathy. That's it. So okay, but you can try to do this. So this is so she actually drank it, you know, drank it for about 750 ml per day, every day of Elo water. But then after that, I disappear. You know, she like, I thought, you know, she, because she's 14%, you know, she might be dead by then, you know. So I so I met her again about 11 months after that in my one of my talk in Kuala Lumpur. So then there you are. She came and she was different. So she was different in the sense like she already putting on weight, and then she bring me all the result that you know, the cardiology report saying that the LV function, the contraction from 14% equals to 57%.
Oh my
And then
God.
all the uh, just purely because of that, is there anything more that you did? So you know, that that keep me wondering, you know, because you know, I was actually I'm helping her. She survived, and she was full of praise about this thing. So this is one of the few earlier case that I encountered, which is very make me believe. And when I study more, and then when I look at the all the data, when I look at the medication that she was on, there's nothing that could actually reverse back within 11 months for her to be normal again, you know. So you are actually return a wife to a family, a mother to their children, you know. So I feel very good. So I know that I'm doing the right thing. See? So of course now after nearly 3 years, okay, of course, you know, the water is well accepted now in Malaysia, especially in a lot of doctors are using it now for their patient, not as a sole therapy, but to complement whatever medication that patient is on, and they found out that they're improving very well, especially those with chronic diabetes on insulin, on, you know, multiple oral hypoglycemic agent. They can see that some of them actually off one medication, and I have one. I think I have two patients actually off the medication totally after 1 year. So I think that's a good, very good turning point. You see?
So you could recommend to anybody to drink the water for a
Yes,
long
yes,
period
of
of time.
course.
Don't just drink it for a
Correct.
week. And
No, no,
and
no. They knew about it now. So in order for them to get the benefit, this is cannot just buy one bottle and say, you know, you have to drink consistently according to the you know, the recommended way for you to drink it for a long time for you to get the benefit. And they get it. Once they get it, they cook up, they will drink, you know, they will drink,
listen,
and then like me, the whole of my family drink.
I want to ask you, are you still
Ah,
drinking the water after 3 years? Are you still drinking the water?
yes, of course, of course. Me feel me. I look at me. I like to say that I
Oh,
look
it's
young.
very good. Very good. Excellent.
You know, yeah. So, but of course, we don't have the liberty or the pleasure for your bath in like in Budapest. of course, we have the bath in Singapore, the ELO bath, where you can actually dip into that bath and get yourself rejuvenated. But because of the COVID things, you know, everything is put on hold. But one day we want to bring that bath in Kuala Lumpur. So you got the facilities for you to drink the water, and you have got the facilities for you to take a bath, you know, when it's needed, you know, the ELO bath, right? So I
Yes.
think we are on the right track. I love what I'm doing right now. I'm still practicing the way it should be, but every patient that I know that come for heart surgery, I will ask them to drink this water for at least about a week before they go for surgery, you know. And from my experience, these are all my friends, you know, my contact, you know, they come for open heart procedure and so on. When they drink the water, they become, they you know, they stay in ICU for about a night, you know, then they leave the hospital faster, and you can see that their wound healing up very well, you see. So I know, I'm glad, you know, I'm glad I can suggest, because I'm sort of combining both, you know, the Western medicine and also this also called alternative drink, you know, for us to get the benefit for the patient to get, you know, when they go for all this major surgery.
Okay.
So
So, uh,
I'm very
uh,
blessed.
Dr. Said, so
Yep.
I want to ask you about, I know this end of yours, what you're doing here, it's for the people and
Mm-hmm.
you're trying to help them. But in the beginning, I did not tell anybody you are a Dato. You know,
Ah.
can I talk about that? I know it's very important, Dato, because when I went to Malaysia first time, I did not know what does that mean.
Okay.
And, you
All
know,
right.
so can we talk about that? What is that? Short, or just not touch it?
Yeah. Well, in
Because
Malaysia,
you are a very
you
special person. You are not the guy who, you know, a doctor who tried to make money from here and there. You're not this type of person. You know, the people need to know who you are, how good heart you are, who you are
yeah.
on as a Dato.
So in Malaysia, you get the many Dato in Malaysia actually, you know. So for you to get recognized, sometimes by the royalty, Malaysia they still have royalty. Sometimes, you know, the government they recognize your contribution to the society by giving you this title, you know. So if you are, it's not easy to get, you know, but I don't ask for it, but it's given by for me it was given by one of the royalty. So because for my contribution to the society, so you have to carry your title very well, because you are supposed to like a representative of that state, you see, that whoever giving you that recognition, you're supposed to be their representative. So you have to act on well, you have to say, you know, you have to, whatever thing that you say from yourself, it has to be truthful, you know, you shouldn't be uh, engaging into all this immoral activity and so on, you know. So if you be in Malaysia, there are many people like me, and some are professionals, some are not, you know, but if you ever come across this in Malaysia, you also will get from I will recommend you one day because of your contribution to the world, you know. So this is like
It was,
is the achievement, is the
brother,
achievement in a way. Yeah.
brother, it was
Yes.
very much surrealistic for us when we went there and we don't know about what is Dato. And then I find myself right beside the throne with the real queen and 270 royalties and everybody listening about the water. I mean,
Yeah.
that was very surrealistic for me. You know, coming from
Yeah, of course.
Hungary, from
Yeah.
United States, coming there, we are not very big on
Right.
kings and queens, but
Mm.
it was a really amazing for me how organized you
Mm.
were. You know, everything went so smooth. You know, it went, and I
Mm.
saw how much did you work on that. Actually, you teach
Yes. Yeah.
for, I remember a night before, who to talk to, what to do, what not to do, you know, with Dr. Nora,
Yeah.
you know, to helping us. you know, and I messed up everything, of course, as a good Caucasian guy. I messed up everything from the begin with, but you guys accepted me as, you know, to help, to try to help you, and you were listening to me. So thank you very much for that. And I really love your big family, your royal family. I really like it. And I like the Queen, and I like the Queen. I hope she's listening to us tonight. I hope so. And I like the Queen.
Very unlikely. It's already like 11:30 at
11:30.
night. 11:30 at night. You know, but Robert, putting all this because you have done a good job. You know, without your belief, without you believe in the thing that you do, the thing that you did, you know, with all those, you know, study, with all those experience, with all those people benefit you know, to your society, and then now and somebody believe you in from Singapore, and then you know Singapore is very rigid country, very difficult for them to believe something extra, you know, especially if it is not good. So what the things that what I want to say is that we should be thankful to you, you know, because without you, maybe for me, I will not be able to help my cousin. I will not be able to help my own relative, you know, beside me. I will not be able to disseminate the goodness about this oxygen through water and the concept of tissue hypoxia, and to many people, and they begin to accept it, you see, all over the world. So why I'm saying this, because I become more daring for me to say this and to bring all these VIP people into the circumstances, into this category of yours, because it's true, and they want it, because we know that we can help them, you know. So in a way, those who are already in the drinking this water, is like they begin to feel their benefit now, you know. So I know that we are on the right track, and I'm glad again, you know. I'm always telling you this all the time, you know, because I'm really very fortunate, me and Dr. Nazri, you know, and some other doctors, you know, they're really passionate to be and to go together with the journey with you until the end of our life, and this is what we want to do. All right. So hang
Because
on, hang on with us.
yes, I'm really working very hard now. After my
Yeah.
PhD done, I've been now is
Right.
getting into more into science and getting
Right.
understanding the people about that scientific part of it. So the measurements. I would
Right.
like to share with you one. I did not share this with
Mm.
you yet, or maybe I mentioned
Okay.
it to you, but I want to share with you and everybody who's listening today. Again, we're gonna tape this and we're gonna send this to everybody who's interested about it. I would like to see that oxygen measurements on dark field microscope. I would like to show you and tell you the story until we set it up so everybody can see it.
Mm-hmm.
I had a patient with colorectal cancer, and this patient is stage 4 and went through chemotherapy, and he come to us to rejuvenate, to get better quality of life, feeling better, but somehow could not make it. So I sent this patient to one of my friend office who has a dark field microscope, and
Okay.
this microscope is capable to see cellular level, mainly red blood cells, white blood cells. You can see inflammations, you can see oxygenation in the cells. And what I did, I told the patient not to drink any water before going to this blood test. So
Okay.
this is, again, it's a dark field microscope. I will show you soon. It comes on. Now we share it. I think
Mm-hmm.
most of the people can see it now. Can you see it?
Right. Yeah, I can see it.
Okay, so you can see the red blood cells bounded together. And we know that the red blood cells carrying the hemoglobin, and the hemoglobins is supposed to pick up the oxygen. But in the condition like that, it's not possible to do it due to
Okay.
lack of oxygen. So this patient is very hypoxic. In a mean is hypoxic. So if you took the saturation in the finger, it could be 92 or 91. percent of saturation. It's very low. So this patient has a fast pulse, very hard to breathe, cannot walk up the stairs, no pressure, and just, you know, just start to survive, starving for oxygen. That's what's happened. So after we make them drink the water, after 10 minutes, we took the blood again, and we see the next.
Oh, wow.
So every time you drink the water, ELO water, every single time, Kaqun water, ELO water you drink, you will have this highly oxygenated and very structured hemoglobins carrying oxygen. This patient had, in an hour, had much better effect. So that's why when somebody has a heart disease, they're drinking the water, that is what's come first. The red blood cells line up, the hemoglobin carries the oxygen. So I was very excited about this. So what I did, I sent one of my friends who's drinking the water regularly, lots of drinks, 2 or 3 times a week, goes to the baths for 1 hour. I want to show you when he went in the morning, what happened with him. This is the oxygen you see. This is a person who regularly drinks ELO Kaqun water. This is regular, it looks like this. Okay?
Okay.
This patient, look how much cells, look how much oxygen, and in very good thing. So you could not really get better than that. That's what you would think. But after just 10 minutes, look what happened with with my friend. It is became organized and full of.
Organized.
We can show you right beside each other. How does it goes?
It goes. Yeah, it become more organized. Yeah.
Can you see? It's more organized.
Yeah.
This is a person who's drinking regularly 1.5 liters of Kaqun ELO water every single day. So I strongly recommend to you, if you have capability in Malaysia, to find a dark field microscope and run just a prospective study. Just look at it before, after 10 minutes drinking the water. It could be diabetes type 1, type 2 person, could be ELO drinker, could be not drinking anything, just water or beer, whatever. You can look at the difference in 10 minutes. And this is in blood. Explains everything. Why is that phenomenon you see is occurring? It's because of that. I wanted to share this with you because I believe this is not an invasive way. Some of the doctors can do it very quickly if they have this dark field microscope, and we can come together and maybe write up an international study on this and see what else, because there is many other things we can see in this live blood analysis. Lots of them. We will get to this. We will get to this. There is already questions pouring in, but we will answer all this. How long the effect of less with oh no, Dr. Nazi asking how long it's been. Yeah, it takes about 2 hours, and you can keep this. After that, it goes back again, slows down, and so you need every 2 hours you need to drink about 2.5 deciliter of ELO Kaqun water. And please, for God's sake, do not stop it. What is laying in front of us right now, you know, what is laying in front of us right now with the future, with the viral infections, with the flu, with all those things, you will have to have defense mechanism build, immune system need to be built. And the reason I showed you this, because this is the easiest way. So easy, people don't even think about it. It could happen. Medics don't think about it. It could happen. But after you look at the facts, and you look at it in America, look at it in Malaysia, in Singapore, in Europe, in Germany, in Russia, you look at it, there is No question about it. If you keep drinking the water, ELO, Kaqun water, your oxygen, not just the saturation, but the tissue oxygen is start to elevate. So if that happens, your hypoxic issue will diminish or much less. And that's why I'm showing you these pictures. I'm sure you're going to find good doctors there who he has a capability.
Yeah, well, I will discuss with Nazri afterwards.
Yes, I think you should run cancer patient before therapy, after therapy, chemotherapy, before chemo, after chemo, and then make them drink the water. You will be shocked. That explains everything we talked for the last 4 years, explains everything. Least, if it's not everything, but explains the big percentage of it. Why is happening? So my next paper, what I'm gonna publish, is gonna be about this. I will publish this in about 6 months. I will publishing on this because I'm gonna show the world, no matter who you are, no matter what color are you, you will need oxygen to your tissue. And that's what we're going to do. Okay, sorry to carry the weight so much, but I wanted to share this with you and with everybody else.
I mean, like, very important because this is the scientific, always the scientific research that you have done, and then coupled with the scientific research which ELO has done, can always be combined because it basically the same kind of water originating, just that the name is different, you know. But I think if we, as the time goes on, as the years goes by, more and more research can be shared, of course, and then because these are all to see what else can be shown, you know, the value of this water in terms of like you said, improving the immune system, you know, like improving the reversing back the hypoxic state of the cancer patient, you know, making them more susceptible for chemotherapy and so on, and all this in the end is going to help patient as a whole, right? So I think there's a good things that you have done, Robert. On my side, maybe I will go together with Nazri. Maybe we will discuss after maybe tomorrow or the after. Tomorrow is probably holiday anyway for Malaysia, you know. So so maybe we can look at the things that you have done and then try to, like you say, maybe complement whatever study that you have done on your part, on the Hungary part, you know, from the Asian part. You see?
Yes, yeah,
So
very
this is
good.
what we're
So
going to
we can match it together, I believe.
combine. Yeah.
Okay, there is other
Yes.
questions coming in. The question is talks about you know, about it would help the immune system to fight COVID virus. I say there is no such a thing because this water don't know the technical terminus, don't know the type of virus or bacteria or whatever. The water don't know this. The water is only a pure water carrying oxygen to the cells. But the cells has the answer. 2009, maybe you remember that study, 2009.
Yeah, I remember.
The Chemical Safety and Environment Department, we made the study and make it clear. It was a human trial study with ethical medical license. We get it from the government. The study was aimed on seeing if the immune system, namely the cellular immune system, would respond on the high oxygen content of the tissue and in the cells. And the outcome was not the quantity, not the quality of the water changed, but the natural killer cells number was growing, namely the B cells, the T cells, the activated T cells, cytotoxic index, all the function was elevating after 14 days. So it gives us a good chance to look at CD25 cells, which is mean showing us definite improvement of cellular immune system. Now, we can all agree on that. There is no drug can do that. No drug can elevate natural killer cells. Only nature can do that. And that is the way when the human self mechanism, the human defense mechanism kicks in if the environment is right, the pH is right, everything is right, we are capable to start up the cellular immune system. That's what the study said. So we are following that footstep to look more further how we can prove we have. My answer is the good friend who asking this question. Yes, we don't know because we don't test it on COVID because we did not find one to have COVID patient. COVID patient is in a hospital locked up. They cannot come out. So we don't find them. But I tell you, the water is not cure for anything. The water is replacing hypoxia and elevate immune system. We all can agree the immune system is capable to fighting viral infected cells and tumoral cells. We all can agree on that. I did not say it's curing cancer. I say capable to fighting viral infected and tumoral cells. Not diseases. I just wanted to make sure everybody understand. I don't say this is curing cancer or curing COVID. No, what it does is eliminates the background for that and shake up the natural killer cells to find viral infected cells. So that's what I'm saying. This is my answer to that. Drink the water. If you have chance, take the baths and use the drops. We did not talk about the immune effect on the drops, but I think is a very good effect on that.
Yeah, very good. Yes, very good.
And
whatever.
Yes.
Whatever things that you teach me so far, from your experience, we template it and try to practice it in Malaysia, and we see a lot of good things with our patient. So we have, I would say that we together with Dr. Nazri, we have seen quite a number of patients, where we can actually help them. You can see that they improve from what they were before, and then now after about a year or something, they become different person. I have a very dear friend of mine. He's a professor. This lady, I've been trying to convince her to use to drink yellow water from since 2017. She has breast cancer, metastatic breast cancer. She was always updating her status inside the Facebook and so on. And then I was trying to promote about this water. She never believed it, but until about recently, about 3 months ago, I can see that she become more and more, she's going downhill. Then somehow because she's my friend, I sent her 10 packs of yellow water for her to drink. And will you believe it? She's getting better. She was, she all the time that she has to go for chemotherapy. And at one stage, she was, the chemotherapy was hold because the blood workout was not that good at all. After about 2 weeks of drinking this water, 1.5 liter every day, then suddenly she find that all the blood workup becomes normal again within 2 weeks.
Wow.
And then she began to understand. Then she began to talk to me. Then we become good friends, Then because she's a professor, mind you, so she has a lot of knowledge about cancer because she's herself a cancer patient. And you can see, when you come to Malaysia one day, I can introduce you to her, and you can see that to me, she's very good now. She's promoting the things. There's a lot of there's a lot of patients with the same condition as her. Not to say that this is curing cancer in that sense. You are just reversing back the hypoxia, that part, So we have to be very careful the way we place it, you see. But he has done good. So I'm very happy for her.
Oh, fantastic. You see, this is a beautiful story. This is really good. Also, a lot of people asking about, is that cure for this disease, this other disease? And I always tell them, no. Look at diseases what not belong to hypoxia issue. If you can identify that, it's very easy to say it could help or not. Because Elo and Kaqun water is not good for everybody for certain diseases. In another sense, yes, everybody needs more oxygen. Everybody needs better cellular function. Everybody, but maybe the disease is not concerning any of those factors. But anybody who's falling into that section where the immune system has to be strengthened and the hypoxia has to push down, the hypoxia issue, this is one of the most non-invasive way to do it. Just easy. And people just need to get used to it. Again, people need to drink water. How much water do you drink a day? How much water do you drink a day?
2 liters, 2.2 to 2.5 liters a day.
Okay, out of that, 1.5 liters is Elo water.
Correct, yeah.
Okay, so I said to you, but must drink water. You cannot drink 1 liter of water, no matter what kind of water. And some people choose it because it's clean. Some people because it's cheap. Some people drink it because there is nothing else to drink. But 1 liter will not gonna change anything in your cellular level. It's gonna keep your bladder flowing and your bladder cleaning, but not much. Your urine gonna be yellow and all kinds of color, smell differently. But if you start to drink 1.5 liter of Elo water every day, 5 times from the morning to the afternoon, 3 deciliter of those, no matter what your weight and height, you will have always clean urine, clean bladder. That means you have no toxin in the tissues. And that's very hard to do. It's very
I know.
hard. What?
But sorry, I drank about at least a liter a day. Sometimes 1.5 liter a day. But when I first started last time, I drank 1.5 liter a day for about 6 months. Then I began to one liter, 1.2 liter like that, So, but I think it's okay. So there's another question from Dr. Nazri, the public response. Now I can say that people are more, because now people are more focused on on health, especially in Malaysian scenario and all over the world. COVID-19 is really a very scary issue. So they want, so we can never know. You can look normal, but yet you are the carrier. So everybody wants to improve their own immunity, So that's why this is a very simple way for you to do it. So the acceptance, as far as the public is concerned, is getting more and more. You just have to continue to, to talk about it. Everywhere I go. Remember the small gadget that you give to me. There's the VII. I always carry every time that if I see my friend, whoever, just check and just check their oxygenation. So, and then, then it become a conversation, then of course they will try this and so on, and then they will see their effect. So I think as far as Malaysia is concerned, the acceptance of Elo water be getting wider and wider. And then not only for those who are challenged with medical issue, but also for those who are healthy, among the athletic, among the kids, among those are well, because they want to remain well and they want to fight the infection, especially in this COVID-19 era. I think you have done a good job.
Okay, so we have another one.
All right.
Michael asking this question: should we teach better breathing and better diet as well as use of Kaqun water? That is the question. And if I may, I answer to you very simply. First of all, yes, we need to teach the people to eat right, rest, sleep right. That's very important, sleeping. And yes, the diet, what you eat, who you are. We didn't invent this. This is from Greece, Hippocrates said that. So we have to learn from the past. So what you eat, who you are. If you eat garbage, you will not gonna live too long, because everything else will be messy and inflamed, and pretty soon you're not gonna be able to handle it. Kaqun water is a base. Kaqun water is only a water what bring in information by clustered water form of oxygenation of the cell, and it releases it. Michael had a very good question also before that. If there is patient who has not good circulation and they, you know, they cannot carry the oxygen all the way, I say to them, drink the water, because without exception, every cell will get benefit from this type of oxygen, but carried through liquid. Many people don't understand how the oxygen gets from a liquid to the tissue. Because when you swallow it, it's supposed to go to your stomach, mixed with the stomach acid, and goes down to the intestines and all the way to the large intestines, and then the leftovers come back to the tissues. I tell you, the oxygen comes immediately. Soon as you drink it, it will go. If you create pressure in your mouth, you hold the water in your mouth, you create pressure, you can measure it in 3 minutes later in your tissue, the oxygen will elevate. And that is amazing. Okay, so that's only one way to do that. It's called diffusion, partial pressure different. And that's the way the oxygen gets to your, from your gut to your brain, to your hair, to your nail, to your lungs, all over. That is the way to go. Okay? So Michael had a very, very valid question. There are experienced treating patients with COPD. Did you ever had somebody with COPD? We had many, but do you had anybody? Dr. Syed?
Yes, I have.
And you had good success with it to treat them?
In terms of hospital admission, you know, because last time this particular gentleman, you know, he was diagnosed to have COPD for a long time. He's frequently admitted to the hospital because of this COPD. But now, from the last, I think, from the family from the son, saying that the father become, the admission to the hospital become less frequent. He's able to enjoy, you know, a bit of outing. Before that, he was really homebound. So I think he has improved a bit on the quality of life that he has, you see. So that reminds me, because I need, maybe tomorrow I will just give the son a call and see how the father. But so far, I mean, to me, good news. No news means good news. Unless somebody died, he will inform me. But so far, no news. You see,
Yes.
so good news. But
Okay,
one thing I want to tell.
Yes.
No, I just want to, I mean, it was just a take-home point as far as I'm concerned, you see. You have, in order for us to get the benefit, you have to be consistent in your water. You cannot sip the water, you have to actually drink it. And drink it regularly for you to get the benefit, right? So that means if you are required to drink 1.5 liter of Ilo or Kaqun a day, you have to do it, you know, especially if you are starting over. But if you can continue it for the rest of your life, which is very good, I will do that. You know, I will drink at least 1 liter, 1.5 liter a day, every day. And then this is the message that, you know, I want to tell those who are watching us tonight, to actually drink it consistently, and you have to be motivated to drink for you to get the benefit.
Okay,
all right,
fantastic. So let me share my story with COPD, because COPD treated with oxygen. And after the emphysema sits in and COPD start to destroying the alveoli in the lungs, they have no capability to exchange CO2 and O2. So what's happening, slowly but surely COPD sits in and they start to get fibrotized and slowly covers up the whole lung. And that just gets worse and worse and worse. One of the stages of this, when you have to carry oxygen in the tank and you have to be 10 liters of oxygen every day, try to make your tissue oxygenation better. The problem here is the next. And I want to clear this out, especially the patient who asking this from UK, or a doctor who is using this Kaqun water. The difference is what you get pure oxygen, 100% pure oxygen in the hospital. This comes directly to the lungs, and the lungs will pick it up, and the hemoglobins pick it up and try to carry it to the bloodstream. And then we are coming back and try to get to the cells, to the lung cells too. But the lung cells not capable to keep it up, so the oxygen will pass by. Eventually, you feel better because you have a little bit better breathing ground, but only for a short period of time until you using the oxygen in the mask. That's the only time you feel better. With ELO Kaqun water, is never gonna get to your lung that way. It's coming from partial pressure difference between the liquid carried oxygen, much higher pressured than in your bloodstream, or even your tissue. So once it's inside, this diffusion has to happen, because the higher pressure wants to give lower pressure wants to reduce lower pressure, wants to bring it up. So what I try to say is the COPD patients are very happy by not using 10 liters, 8 liters of pure oxygen. After 6 months of drinking the water, they maybe use 15%, 20% of those. So their quality of life is much better, and the deterioration and the progress of the disease dramatically slow down. That's what we see with a lot of our patients. So I strongly recommend, if anybody has a problem or know somebody have COPD, comfortably give them the water. Don't forget to go to your doctor. Depend on your condition, remember, but drink the water so you're gonna able to breathe easier and better. Okay, so I think we have a lot of good questions right here today. This question was from the UK. So, you know, people listening to us from all over the world. I think the time is about up in 1 hour. So I would like to thank you very much to take this late time and sharing with this world. But before we go, I would like to thank our university who's joining up with us from the University of Humanitarian Medicine in Canada, Toronto. And I would like to mention the professors there, the doctors there, who are just learned about it in January, how this water works and what it does. And guess what? Already thousands of doctors using them. And it is a very big breakthrough in Canada. And I would like to thank them, also from United States, also from Singapore, all the wonderful studies at Monash University, and also for you guys being so relentlessly, you know, supporting us and teaching us and sharing information with us. I hope one day I can get you back in my show again with good results, good results. And you have 1 more minute to say goodbye to everybody, and thank you very much for being here.
Yeah, thank you very much, Robert, you know, for this opportunity. I mean, like, like I said, you know, this is like the journey that going to be there with me for the rest of my life, you know. I will continue to disperse, to share the benefit of oxygen-rich water and how you can actually reverse by your tissue hypoxia. So this is what I'm going to do, and I hope you will gain something from the discussion tonight. But of course, you know, this is more very simple. But we'll see you in any of the scientific meeting organized by Kaqun 9, Kaqun 10. Maybe one day you can come over to Malaysia and we organize a big Kaqun conference here in Malaysia, in Kuala Lumpur. Okay.
Okay, and I would like to invite you to this university one day with me, and I really want to be a part of it. And I will find a way. I will find a way to join up with them for you too.
Yeah.
Thank you so much.
Yeah. So there's one more. Yeah. Just want to say thank you to Ilo Water Singapore for bringing the water in this part of the world. You know,
Most
Jolene,
definitely.
Miss Lan, yeah, Olivia Lam, and the rest of the team. Thank
Yes.
you.
Thank you so much. Thank
Bye
you.
bye.
Thank you. Bye.